Hello, and welcome to the quarterly Close Community Coalition meeting where all are invited from the community. We are the Coalition of Longmeadow Organizing Substance Education. Thank you to the folks who are joining us in person. Thank you to all the folks watching at home. Thank you to LCTV for filming this and capturing our work. And Brian Kazaska and LCTV. What a great partner that you are, and we love working with you. So thank you. It's a relatively tight agenda tonight, and a very efficient group of folks in the room, so I'm excited about what work we can get done and updates we can provide one another. And well, this should not be an hour-long meeting. This should probably be a little quicker. So let's get started. Over the summer, it's a really great time, I think, for the coalition to sort of reassess a bunch of different strategies that we take on, environmental strategies, some assessment and evaluation work we do. We're going to do a little planning tonight. We need to think a little bit more about capacity building for the long-term sustainability of the coalition. The summer is just a great time to reflect on a bunch of stuff. And I wanted to just draw our attention to the strategic prevention framework, which really helps drive a lot of our work in this prevention field of public health. Today in particular, I want to talk about assessment in the form of focus groups, key stakeholder interviews, and I want to talk about implementation in the form of the cannabis billboard data collection project and the electronic nicotine delivery system shoulder tap survey, and then building capacity and building skills in town with the community Narcan trainings. So we'll talk about that for that plan for the summer and talk about who to have focus groups with, who to have key stakeholder interviews with. And we're actively and consistently working on building cultural competence in the coalition. I've recently attended a diversity, equity, inclusion training with some key board members, and I'm really excited about the direction of the school district and the coalition in regards to equity and inclusion and diversity. Sustainability would be great. We just got year 6 through 10 funding from the CDC, and we are in year 6. We have up to 10 years, but then after that, we're going to find a way to try to sustain this work, if not in the form of the coalition, certainly in the form of having people carry the strategies out in posterity. Am I saying that right? Great. In perpetuity? What does posterity mean? Okay. What? I'm sorry. The people in attendance in the room are some of the most fun, wonderful people in Longmeadow. So there may be a giggle. Just prepare yourself.
I should chime in.
Yeah. There was an awesome group of teenagers from the Students Together Against Negative Decisions group that came together a couple weeks ago, and we completed a ton of cannabis billboard data collection, which was very exciting. And the project is basically taking every billboard in Hampden County and tracking what has been projected on it or advertised on it for the last 10 years, and seeing how many billboards have been advertising cannabis or alcohol. And the reason we're doing that is in particular about cannabis, because cannabis billboards have really taken over in a lot of Hampden County billboard locations, especially around thoroughfares like 91 and 295. And so we've had a lot of people concerned about, like, are our young people getting exposed to cannabis advertising and cannabis billboards too much, especially according to the law, which was supposed to be protecting people under the age of 21 from all these advertisements. If you didn't have a billboard in a location that would be seen by anything less than 85% of an adult population over 21, then you couldn't advertise illicit substances like alcohol and cannabis for young people. And there's really only one billboard in Hampden County that meets that threshold. So we're just tracking, how many billboards are advertising cannabis, and how many billboards are advertising alcohol in the area, and we're going to report that to the Cannabis Control Commission because no one's really tracking that. And so it's really cool to have young people engaged in this project, and working really closely with the folks in the Franklin Regional Council of Governments. Nick Hathaway is one of their assessment and evaluation coordinators, and he's been an awesome person to work with to sort of set up this data collection project. Anywho, we're going to have at least 1 or 2 more get-togethers over the summer where students will actually drive around key parts of Hamden County and photograph current cannabis billboards or current billboards, because the data that we can collect from the Lamar sort of historical information online that we have available, you can see a billboard picture 1 a year from each location, but you can't do really super current photos. And so that's something that we wanted to do this summer. Just wanted to keep people informed of some of the stuff we're working on. It's really interesting work, and that'll hopefully help inform policy where we will expose young people to less cannabis advertisements in the future. The point being, when young people are exposed to any advertising obviously is meant to increase sales of whatever the product is. And if the product is an illicit substance that's addictive and potentially harmful to the developing brain, the more exposure young people have to those advertisements, the more normalized that substance becomes, and use can go up, perception of harm can go down. And so we want to protect young people from those effects. Vaping shoulder tap surveys. We've worked with Enfield closely for the last few years, and the Enfield Police Department and the Enfield Together Coalition. And the Enfield Police Department has a group of teenagers called Explorers, who are young people who want to advance into the field of law enforcement someday. And so it's sort of like a really hands-on internship for student leaders down in Enfield. And we do shoulder tap surveys where we essentially have student volunteers approaching strangers in front of a vape shop and ask them, if I were to give you a certain amount of money, would you buy me a vaping product? And we're trying to get a percentage of how many people would buy a stranger, a minor, an illicit substance if they were approached. And the good news is last year it was 79% would not buy students vaping products, which was great. So we're going to do at least 1 more shoulder tap survey this summer, which is a great way to assess how easy it is to socially access these substances. And there's not really any active vaping shops in Longmeadow to do this sort of thing, and Enfield's got a ton just right over the line in on Route 5. So we're going to plan to do that with some youth leaders, some recent graduates of Longmeadow High School, and then some existing students as well. Just a fun thing to do over the summer where students have more time to commit to stuff like that. And then community Narcan trainings. We're teaming up with Longmeadow's Police Department and Mike Drakowski, the chief liaison there for our coalition on all things drug addiction response team, or DART. And so he's got a bunch of resources that he can throw at community Narcan trainings to make Narcan available to people in town and to increase people's capacity to understand signs and symptoms of potential opioid overdose and how to respond. And so we've been trying to get into the farmers markets in Longmeadow the last couple of years and have had no success, but I have a feeling that this year is going to be different. I think we're going to get in a few of the farmers markets over the summer. So just keep an eye out. Is that on Wednesdays? Thursdays. Okay. So keep an eye out at the farmers market over the summer for some free Narcan training and some information about prevention and opioid overdose prevention. Let's see. Oh, and if anyone in the community wants me to come join them, if it's Glen Meadow or any other community-based organization, if it's Parks and Recreation, if it's anything that you want me to come and train staff or constituents about Narcan training, just let me know, and I can provide that training for free. Just let me know at paul@coloscommunity.org. So here's the first question I have for the group in the room, which is, we are going to take on some key stakeholder interviews over the summer, and I'm wondering who we should target to interview as far as key stakeholders in the community. I was just thinking this afternoon about, I've worked really closely with Chief Robert Stocks a bunch of times this year, but I've never officially done a key stakeholder interview, which I think he would be awesome for that. So the chief is on my mind of LPD, and I wonder what other people were thinking. I could do 8 to 12 of these, because you can pile them into one day. They're really fun. I haven't done Lisa. I've interviewed Candace. I think I interviewed Chris.
Yes.
Yeah. But Lisa, you're on the You're gonna get interviewed this summer. Get ready.
Oh, my.
Yeah.
I'll have
Keep
to
those
dress
shades
for
on.
that.
Are those prescription sunglasses?
They are, and they've got like a gradient so I can read because I don't have my regular glasses.
Okay. If you need to borrow mine, let me know.
Okay.
Yeah, we're just looking for, so it's the key stakeholder interview transcript is basically a bunch of questions about what are the protective factors in Longmeadow? What makes Longmeadow a great place to grow up? What makes Longmeadow a great place to raise kids? What makes Longmeadow a challenging place to grow up or raise kids? And we try to capture people's qualitative information around that, because we have tons of data from our student survey, but we don't have a lot of qualitative data from parents and key partners in town. Who else should we go after?
I think you should interview someone who grew up in town and then raised their kids in town.
That's a great idea.
Terry
There's a
Dittmar
lot
was
of
one of those people, but he moved
Okay.
away.
There
But
are a lot-
he was
there
so
are a bunch
good.
of people like that, but
Yeah,
I think
there's no shortage. of-
yeah. But I think that would
Bobby,
be-
I think grew up here too, right? Bobby Parquet.
No idea.
And I interviewed him in the first couple of years. But yeah, I would love some new. Do you guys know anybody? I'd love some
Yeah.
names.
Yeah, we can give you.
Yeah.
Yeah.
we'll furnish
And
you.
yeah, you don't have to even out people right
Right.
now
Right.
because you all have my email address and you can
Right.
shoot me emails. But any more public leaning figures would be great too. I'm thinking Barry Jarvis is the Parks and Rec department director,
Mhm.
and she
Mhm.
employs tons of teenagers over the summer for like Parks and Rec camps and swimming pool and things like that. So I would love to interview her as well. I've never done Mike Capitasso is the athletic director. I do tons of different projects with him, but I've never interviewed him. As I think about youth sports,
Mhm.
90% of Longmeadow High School students participate in at least one sport, which is really high.
Mhm.
So he's got such a protective
There are
effect.
also a bunch of coaches who live in town, raise
Oh,
their
yeah,
kids
that's
in
true.
town. Like, they would be great for you to, because they have like a
Oh, yeah.
huge perspective.
Hmm.
That's true.
There's also there's data around those high impact sports, so like hockey, football, lacrosse, like the sports there's a lot more contact. Those students potentially have riskier behaviors around substance use, and so yeah, those are great coaches to talk to as well. If you can ever, for some reason, cross country and tennis just not the huge substance using population for whatever reason. Isn't that interesting? Traditionally, I'm not saying.
Mhm.
Yeah.
Not saying they don't know how to
Yeah.
party, but in my experience with coalitions, it's definitely been those higher impact sports.
Are they more likely to have injuries and?
Oh, for sure,
Get
more likely to have injuries and then have
prescriptions and-
potentially opioid
Yeah.
prescriptions provided for,
And
you
the
know.
more equipment, the more money you need.
Mm-hmm.
All right, so key coaches, and I'll bug you guys for that info as well. Anyone else? Oh, there's going to be a new.
Teachers, do you ever?
I usually leave them alone during the school year, but if they live around town, I'll just get them coffee. It seems like a nice. But there's an art teacher or two. There's a couple of like key teachers that students really connect with, and that would be really clever. I'll check in with Shelley and then a few other students. Ms. Shelley Warren, substance addiction counselor for the school district, who's going to Texas tomorrow, really early in the morning, I think. So that's why she's not here. Her son Nico has orientation at Texas Tech now, which seems so interesting.
But they probably start really early.
You
right?
think?
Yeah, they do start earlier. They
Like
start-
earlier than
'Cause they
August?
get
Beginning
out of
of
school
August,
early.
though.
Yeah.
Oh,
Yeah.
really? How
Yeah.
come?
It's hot.
Yeah.
Oh.
They get out.
But isn't
So
that
they
like
get-
the peak
They
heat?
get out, but they get out, yeah, they get
They
out
probably
much
got out in
earlier,
May.
Yeah.
Oh, interesting. Okay. That sounded so early. So I'll ask Shelley and stand members about teachers.
I'm also wondering about like maybe local pediatricians or I don't know, maybe someone that works in the mental health field, like a therapist or a counselor that lives in town.
Dr. Segul. I've met with him, but I've never had a key stakeholder interview. He's like, do you know him? It's like one of the partners
He was
down
over at Pioneer
Pioneer
Valley.
Valley.
Yeah.
Does he live in town?
Right.
There's some number that,
Okay.
who live in town?
Yeah.
I just wish I knew a
Yeah.
pediatrician.
Lived in town.
I know.
I think I know
all-
one.
Yeah, I know.
My buddy Eric. No. Oh,
I have access to these people.
yeah. You do have access to these people.
Well, because-
and you also are one.
I am. I don't really have they have access to me, which
What
is
so
about,
scary at
would it
times,
be
but-
interesting to interview a graduate, but like who's like now 21 or now done with college or something, and like have them like think back to their time when they were in high school?
I think that's an awesome idea. There's such a great
I
cohort.
have one.
You do?
Yeah.
Mm-hmm.
Do you think
I
they'd
have one.
meet me for coffee? There's a great cohort of former stand members who I was going to do a
Yeah.
focus group with. But that
Great.
doesn't mean,
Yeah.
but
Yeah.
focus groups are very different outcomes than those key stakeholder. That's such a great idea. So I can pick a couple of key individual 21, 22ers.
Mhm.
I had a great discussion with my college graduate and his college graduate girlfriend, both of whom went through Long Meadow.
Oh, both of them went to Malama? Did they meet here?
No, they
Interesting.
started dating in college.
Oh.
I mean, they were in different circles.
Oh, shoot. This is
What?
such a lovely meeting. It's being televised and
What?
hopefully it's
Oh,
not
my
too
gosh.
private. Yeah. I know, it feels so
You know who it
informal.
is.
Yeah. The person who is speaking now is named Jonathan Van Kress. And Jonathan, thank you for coming to the meeting and talking about your children. Oh, man. There's the giggles. I told you. I warned you. I think these are great ideas. I'd love to meet with any of those folks. Okay. Well, if you think of any more, you just go ahead and let me know. So the next group was focus group. So there's, I have a communication out to Barry Jarvis about working with a group of camp counselors after one of the day camp days ends to do a focus group about just growing up here and being a young person. And so that is happening. So that's a Parks and Rec.
What about the parents of younger kids, stakeholders, like,
Hmm.
not people who are in the thick of it quite yet?
I have contact info for the PTO groups and the PACs, so maybe
Oh,
I can
okay.
ask them.
Okay, yeah.
For like any of the participants who might want to
elementary,
meet up.
yeah.
Because I was trying to present the data at PACs and PTOs in the spring. The only group that squeezed me in was LHS, which was great. But the other groups just had other stuff going on. I guess they didn't want to invite me. But I can follow back up with them
Yeah.
and ask about that. That's good thinking.
But either but like who John, whatever, was saying.
Jonathan Van Kress.
Yeah.
I get one of those
Either
voice
as like a
memo
focus group or even just like, some people, everybody has a story for why they like came here, right?
Yeah.
And then, but it would be a good time to also introduce people because they don't even know about Close.
Hmm.
Yeah.
So it could be multi-purpose, I guess is what I'm saying.
I think that's a great idea. I don't think I've ever technically interviewed Amy Steck over at the JCC.
Perfect.
She would be great. Because she's in charge of all youth programs at the JCC. A great partner. Although not in Longmeadow, used by many Longmeadow families.
It counts.
It does. Okay. Well, focus groups. Are there any other groups that you guys can think of that would be really important groups of people for me to? Actually, now that you're mentioning this, I'm like, there's like not grand rounds, but is it the Meadows Pediatric Group in Enfield?
Mhm.
So they get together. I think they have it might be weekly, maybe it's monthly, a meeting. I feel like it's tight. I tried to get in on that agenda recently.
What are the Meadows Pediatrics? division?
Meadows Pediatrics here.
It's only two
It's only-
practitioners.
Only 2 doctors?
Yeah.
Oh, okay.
Yeah.
I met with the Enfield group once and it was
That's
more.
Pioneer Valley.
Pioneer-
because
Oh, it is?
there's
Yeah.
Practices, yeah.
Okay. The meeting was tight. I don't know if I'd have enough time to do a focus group, like a genuine focus group. That would be a bummer.
I think Judy Tapper has been sort of an advisor for the school committee.
Yes.
She's from Pioneer Valley.
Dr. King wanted to get together. Who's that the child psychiatrist? He could probably be an interesting key stakeholder. But we're supposed to be on focus groups. Yeah, what other groups of folks?
Would you want to talk to kids who just graduated?
Yeah, that was a group I was planning
But
on meeting.
I mean,
Like-
this current stand
Like
people.
the Jonah Baresi crew, and
Right.
then and the Catherine Mulkey, and then there's the existing group now.
Got it, okay.
Who I would love to have a.
I was wondering about kids who weren't involved in that.
Yeah.
Oh, yeah,
Right?
that's such a good point. Yeah, because they might not necessarily be active substance users. Yeah, or exposed to that, social group. Okay, that's cool thinking. Even just the three of you, I feel like I could get an interesting cohort of 20.
Moms.
I would say, or no, just 18 to 23-year-olds, right?
Well,
22.
12 to.
Oh, yeah, 11.
But I'm thinking like the older students who graduated,
Yeah,
they weren't
yeah.
in stand.
Yes,
Yeah.
I
yes.
would be really interested to pick their brains.
Yes.
Jonathan has like a whole
Jonathan Jr.
spread.
Oh my
A
God.
longitudinal study.
Oh, thanks for being here, John. Any other groups? I think it's funny because I think there are cameras just looking right at you. It's not like
okay.
It's not like you can hide. Oh my gosh. No. Yeah, can we get some voice modulation, Brian, from LCTV?
I'm wearing my hair differently tonight. I had it in a ponytail. It's like all brushed out.
I think it looks great.
I don't think anybody's going to
It
recognize
looks great, John.
me.
It looks great. Great. Well, any other suggestions for focus groups? And again, you all know who I am. You can reach out to me. And then this is just something I'm going to continue to push for, but just certain folks, if people can think of individuals they know that, they'd be so good at helping with event planning or outreach and marketing or youth cannabis use prevention. People with that in particular is like anyone in the retail space. I know there's at least one dispensary owner who lives in Longmeadow. And then assessment and evaluation, this is the time to analyze all the data we just collected. The middle school just finished their school climate survey, which is it's their third year with 8th grade, fourth year with 8th grade, second year with 7th grade data. So it's always interesting to look at their data. Such good middle school data in this town. Just students have very, very healthy behaviors traditionally. So I'm curious to see this year's. And then overdose prevention and recovery. So that's naloxone trainings. And then close compass volunteers. We sort of had that sort of quieted down, which is disappointing. So I would love to have more close compass volunteers. That would be people volunteering who have lived experience with a family member or loved one who has struggled with substance use, and they want to be available to help people as they navigate their own experience, so they can be available for a phone call or something like that. And we've had 2 or 3 people reach out in the last couple of years, but not too many people, but it's just a really great resource, I think. So those are the action teams, and we would love it. Please reach out to me at paul@closecommunity.org if you are interested in joining any of these action teams, and also if you know of a person who would be a great fit. I think we've got a few contacts at BayPath right now, which is exciting, and things are looking up for next year, being a little more active with these action teams, which would be great. Let's see. I want to thank all the homes in Longmeadow that hosted lawn signs for the Parents Who Host Lose the Most, which I wish was called Parents Who or When Parents Host, Everyone Loses, because that was something that came up in the last meeting. It was just such a great turn of phrase. But we had over 60 signs, I think, in town this year, so that was really cool to see people embracing that message around the normalization of parents not allowing alcohol use in their home for minors. And we just were reminding folks the last week and a half about checking your kids' backpacks just for substances, paying attention this time of year, and really checking in with their student, talking early and often around substance use, what the rules are in your home, what the consequences are, and how to follow up with care and consistency. And so we just were reminding folks this is a big time of year with prom and graduation to have celebrations and gatherings as safely and and thoughtfully as possible. And please take our survey if you haven't already. If you're a parent of a Longmeadow teenager, middle schooler, or high schooler, please complete our survey. It really helps us, it really helps inform us on what parent practices are and what the norms are in town. And then it helps us focus on what needs to be addressed as far as risk factors and what assets we have as protective factors. And then come to our next meeting, please. The plan is for September 5th. The school committee might be meeting that night, so we have to keep our eyes peeled. It looks like that is not the night that they will meet as of now, but they're going to figure that out in the next week. But the plan is Tuesday, September 5th, 7 p.m. right here at Longmeadow High School. And not in the BTC. We'd love to have it here on LCTV. And I'm going to check with Brian Kazaska right after this meeting just to confirm that, making sure that's okay. Oh, Brian Kazaska, that's how we have to have a key stakeholder interview with.
It's okay.
Oh,
Keep it going.
okay. Thanks, Brian.
Okay.
Brian, I think that's it. Thanks for joining us. Have a great day, Longmeadow.